And if we go back to the way new patients come into a practice, doctors, I'd like all of you to take a look under a magnifying glass at how a new patient comes into your practice. What is that new patient appointment? What's that new patient experience? Recently, a new client of ours, Naren, shared with me, Gary, I really want to work on my new patient experience. And I said, hey, before I just tell you, how we might evolve that, tell me what you're doing now. And he said, well, because most of our new patients want to have their teeth cleaned, we are bringing them in, through the hygiene department. I'm taking a quick look at them before we provide the hygiene appointment so we can determine their periodontal health. And then we're providing a hygiene service. And then I come in at the end of the appointment to do my part of the new patient appointment. And I asked him, I said, does the doctor part of your new patient exam go on your schedule, as a dedicated appointment time where nothing can go opposite because you can't be in two places at once? I always tell my clients, if you could figure out how to be at two places at once, please tell me, because I want to learn that trick. And it doesn't exist to be in two places at once. So I said, no, Gary, I'm treating it like a hygiene exam. It's not on my schedule. And I said, in the famous words of the TV psychology personality, Dr. Phil,
right?
How's that working for you? He said, not very well, because I'd like to be spending 20 or 30 minutes with him, but I don't have that amount of time. So if that sounds a little bit like you, or some variation sounds like you, perhaps we need to revisit what your new patient experience is all about. And maybe we can combine topics here and have your new patient experience largely led by your treatment coordinator, You don't have to be the one that does all this. In fact, this team member can be a very cool extension of you.
Actually,
doctor, you can be in the next room doing a crown, and your treatment coordinator can be guiding your patient.
Right. And I think humans are extremely good when you allow them to focus on one thing, right? So when you tell the new patient coordinator, your job is to be the advocate for the patient. Your job is to help the patient discover everything that is possible with regards to their oral health. This person is excited. They love people. They love helping people. They know dentistry, and they know how to communicate dentistry in layman's terms. That's their job. That's their focus, right? That's what they're thinking, as opposed to maybe the dentist, he has to do that. Plus he has to think about clinical stuff. He has to manage the office, or even the dental assistant. They have to help the doctor. They have to make sure all the instruments are ready. There's so many other things. So I really like this name you gave it, Gary, this idea, you almost like giving them a purpose. New patient treatment coordinator. Their job is to,